Hi guys, Dr. Mona here, and today we're going to talk about Kybella. Kybella is an injectable product that we use to actually dissolve little areas of fat. It came out in 2015, and I was one of the first people to inject it in Cincinnati and one of the first people to learn about it. I think it's fascinating because they studied this product for about 11 years before they brought it to market, and it's actually deoxycholic acid, which is a substance that your gallbladder makes to dissolve fat. So they studied it originally to be able to be injected in this area, what's called the submentum, for people who have a double chin. And what it does is we inject it in a very specific way, and it actually lyses the fat cell. When it lyses the fat cell, or kind of ruptures the fat cell, you get a lot of swelling. So when we treat patients with Kybella, they get swelling in that area. That swelling can last anywhere from 3 days up to about 10 days, depending on how much fat was there. I always say I like to see the swelling because I know that we're targeting that area. Once the swelling kind of subsides, I give yourself about 4 to 8 weeks before you can see the best results. Really, at 8 weeks, I'd say, is the maximum result. How many treatments do people need? Some people need 2 treatments, some people need 3 treatments, some people need 4 treatments. It really depends on what you have because, again, we're all a little bit different. You might have a little bit of fat here, you might have a little bit of fat here, but it's really going to depend on how you are. I've had it done myself, and I think that it's a very good treatment. Again, you might have to be aware of the downtime. What other than downtime can you expect? It can be a little uncomfortable because there's a lot of swelling there. You might have a bruise because it is an injectable. You might feel that your skin is a little bit numb for a week or so. Again, that will all go away. Sometimes, depending on where we inject it, if we hit a certain nerve, you might actually notice that the corner of your mouth droops for a little bit, and then it always comes back up. It's not a permanent side effect, and it's not very common. What are some of the other areas that we treat other than under the chin? Well, it dissolves fat. So I personally like to treat the jowl area because sometimes you have a little excess jowling right here. You could treat bra fat, or you might have areas that are just little tiny pockets of fat that we can locally treat and address as opposed to doing something like liposuction. So Kybella is very versatile. Because it's naturally occurring in your body as deoxycholic acid, I've never actually had anybody have an allergic reaction. So in terms of risk, side effects, I feel like there's no real risk to it other than the fact that you might get swelling, you might get bruising. If you hit that wrong little nerve in the corner of the mouth, your mouth might droop a little, it'll come back up, but no long-term side effects. How long does Kybella last? Well, once you get rid of a fat cell, your fat cell is gone. So that's going to go away. You're not going to have that anymore. But we continue to age. And so sometimes, even though you may have lost that fat cell, you may start noticing that you have laxity. And so I always try to determine, is it somebody that has more fat in that area, or do they have more loose skin? So we can kind of decide what we want to target. And sometimes we have to target both. Who's a candidate? I'd say anybody who has an area of fat that they want to address can be a candidate for Kybella. Having said that, sometimes people have an area that might be better addressed with surgery, might be better addressed with liposuction, might be better addressed with cool sculpting. So again, making sure that you have a provider who can look at that and give you the best assessment. There really isn't anything else on the market like Kybella, and so I think it's a very safe treatment as long as you have a little bit of that downtime. It's a really nice thing that we have in our aesthetic toolbox to address both aging. It can be a candidate in someone who's younger who just doesn't like that double chin, or somebody who's older who has a little bit of that jowling, or somebody has those little pockets of fat. So as always, so happy that you joined us today. I hope this was informative. Please leave your questions. Can't wait to see you next time.